blood, which is then transported to the rest of the body, and we all know the uses and the functions of blood. So the two largest veins, the superior vena cava and the inferior vena cava. The superior vena cava carries blood from the upper body to the heart, while the inferior vena cava carries blood from the lower body to the heart. So the superior vena cava and the inferior vena cava carries blood from their different areas. The superior vena cava from the upper body of the heart, and the inferior vena cava from the lower body of the heart. They take all the oxygenated blood that they've carried from all these parts of the body to the right atrium. So from the right atrium, the blood passes through the tricuspid valve, where it then enters the right ventricle of the heart. And from the right ventricle, the blood passes down to the pulmonary valve, to the pulmonary artery. Now the pulmonary valve helps prevent the flow of that blood back again to the right ventricle. So from that pulmonary artery, it then enters into the lungs. The pulmonary arteries takes the blood to the lungs for oxygenation. Now, after this blood is oxygenated, which is a topic for another day, the blood then enters into the pulmonary veins. Then these pulmonary veins take the blood to the left atrium, and from the left atrium, the blood passes through the bicuspid valve, which is also known as the mitral valve, and it is bicuspid valve because of just has two valves. It passes from the bicuspid valve down to the left ventricle, which from the left ventricle, the blood passes to the aorta of the heart. The aorta is the biggest artery of the heart, so of the body. So it passes from the aorta to the rest of the body, to wherever it will spread and then come back through the inferior vena cava and superior vena cava and continue its cycle. So that is it about the flow of blood through the heart. And this aspect just explains pulmonary circulation and systemic circulation. Pulmonary circulation in the sense that it is the movement of blood from the heart to the lungs back to from the lungs back to the heart, and systemic circulation in the sense that from the heart down to the rest of the body, and then from the body back to the heart. That is just it. Coronary circulation is another type of circulation, because yes, the heart is pumping blood to the rest of the body, but what is giving the heart its own blood? The heart needs its own blood to function. So it is coronary circulation, which we'll talk about